There are many lifestyle factors that can affect sperm and make it more difficult for men to impregnate their partners. For example, tobacco use from smoking or vaping, alcohol consumption, anabolic steroid use, and obesity are all known to negatively affect male fertility. What about mobile phone use? The use of mobile phones has increased substantially in the last few decades. Mobile phones emit low-level radio frequency electromagnetic waves, or RF EMF, that can be absorbed by the human body. Could RF EMF affect sperm production and worsen male fertility? Surprisingly, there has been extraordinarily little study on this topic. Recently, however, a study from Switzerland attempted to tackle this topic. Let's dive into this study. First, this was a decent-sized study involving 2,886 men. In the past, studies have recruited men who were already experiencing fertility problems with their partners. These studies are difficult to interpret because those men might already have had problems with their sperm and not really be representative of an average guy. This study recruited men in a unique way. In Switzerland, all men aged 18 to 22 years must attend a 3-day camp to determine their fitness for military service. The researchers contacted over 100,000 of these men, and a few thousand agreed to participate. The men filled out a survey of their health and lifestyle and then provided a semen specimen for analysis. Importantly, the analysis was done by computer to prevent variability of having lots of different human beings perform the analysis. One more important fact. The study ran from 2005, when mobile phone use was not so common, until 2018, when phone use was very common. They divided the men into groups according to the frequency of their mobile phone use. Less than once per week, 1 to 5 times per day, 5 to 10 times per day, 10 to 20 times per day, and greater than 20 times per day. They also created 3 groups based on where men kept their phones when they were not using them. Not on their bodies, in their jacket pocket, or in their pants pocket. But what did they find? Men who used their phone more had, on average, lower sperm counts than men who did not use their phones as much. Overall, there was about a 20% decrease in sperm numbers in the highest use group compared to the lowest use group. None of the other sperm parameters like movement or shape were affected by how often men used their phones. The next finding really surprised me. There was no difference in any of the sperm parameters based on where men carried their phones. In other words, there was no detectable effect of carrying mobile phones in their pants close to their testicles. Over time, mobile phone use had less of an effect. Remember, the study ran for 14 years, starting in 2005. There was a larger impact on sperm numbers from 2005 to 2007 compared to later time periods, despite the fact that men used their phones a lot more in recent years. The authors of this study believe this might be because phone technology changed from 2G to 3G and 4G. This corresponded to a decrease in the phone's power output. Studies like this are hard to do. Consequently, there are still a lot of unanswered questions. People use their phones a lot differently now. We use apps and text more than we used to and make phone calls much less. Although this study looked at the effect on sperm production, it did not study whether these changes make it harder to produce pregnancies. We also don't know why mobile phone use seemed to decrease sperm numbers, but keeping your phone near your testicles did not. Our Infertility TV bottom line is this. Using a mobile phone many times a day seems to have minimal impact on sperm numbers, especially if it is a more modern 4G or 5G phone. Keeping your phone in your pocket doesn't seem to be a problem at all. Infertility TV is your most trusted source for accurate information on infertility and miscarriage. If you are not a subscriber yet, hit the subscribe button right now. A new episode is released every week. Don't miss any episodes. You can also check us out on our website, ivf1.com, where you can become a patient.